Hello everybody, welcome to another presentation of the kind of life-changing dentistry that my team and I here at London Dental Specialists carry out on a routine basis. If you like these videos, please subscribe to our YouTube channel or follow us, London Dental Specialists, on Instagram and Facebook. So let's get into today's case. The running theme you would have noticed about the cases in this current section is the general management of gum disease and the various ways in which we treat gum disease and the things that you all need to be aware of. As a general rule, successful management of gum disease leads to gum recession. And there is nothing wrong with gum recession. All right. The case I showed yesterday showed severe gum recession, but it was at the back teeth, and nobody's ever going to see that. The two cases I'm going to show you today are of patients in their early 30s. This lady on the left had gum surgery to treat her gum disease, and this lady on the right, again about the same age, had non-surgical treatment for her gum disease. They both had periodontitis gum disease, and they have both had successful treatment for gum disease. But in general, when they both looked at their smile, they didn't like the appearance of these gaps, understandably so. And again, obviously these gaps, again, understandably so. The options in this situation are: you either have a prosthetic, so a removable replacement of the gums on both sides, and that's the gum veneer that you may or may not have heard of. The other option is to have these gaps all filled in with either porcelain veneers or composite, so a white tooth filling type material. Now, the reason why I tend to prefer to recommend the gum veneer over the porcelain veneers or the composite bonding is really very simple. Gum disease requires, or successful management of gum disease requires excellent control of plaque, so excellent oral hygiene, and these large gaps are much easier to clean than smaller gaps. So if you have a gum veneer, then it's easy to remove it for cleaning and replace it afterwards. Now, please bear with me because I know that some of you don't like the thought of gum veneers, but I'm hoping to persuade you over the next couple of minutes. So let's show you this first case. So this is a lady that had, again, in her early 30s, had gum surgery on her upper front teeth, and that is really what the gum veneer looked like. I will never forget these particular cases because when I was initially recommending the gum veneer, both of them balked at it. They said, no chance. There is no way I could have a gum veneer. No chance. So I said, and I always say this to all our patients, let's have a deal. Let's have a deal. Try my gum veneer, please, for 6 to 9 months. If you come back to me at 6 to 9 months and you say, I still hate your gum veneer, I promise you that I will place the porcelain veneers or the composite buildups myself. All right. I enjoy doing them, but I also know that there are limitations. In the long term, the easiest way of keeping these front teeth is with this gum veneer. And the patient said, and I quote, "Oh my gosh, my gums have never looked so good." This was 2 years ago, and she just accepts and enjoys her gum veneer with a beautiful smile. Now, this is the second case that I showed you earlier on. Again, this is where we started with some small gaps between the teeth, and this is where we ended up. No gaps whatsoever, okay? And this is what her smile looks like. The gum veneer is actually there, and you can barely see it. And the thing that I find most amazing is that she said, even my husband does not know that the gum veneer is there. That is how discreet the gum veneer actually is. So please don't be frightened. They work, and they work beautifully. So why not either speak to your dentist, speak to your hygienist, or just refer yourself to me. And I look forward to discussing with you and providing this kind of very simple but life-changing dentistry. Many thanks.